Dr. Devi, Dr. Shani brought up the economics of this issue, but from a patient's perspective, I mean, I think we're all patients here, and patients are at the core of this debate. What are some of the key issues that exist on the NCD front from a patient's perspective?
Bringing this very important topic up for discussion. I think the realization that patients play an important role as individuals, especially if you're talking of reversing the epidemic, to bring to attention the fact that the patient themselves have to acknowledge that they are the ones who have to bring that behavior change and lifestyle change to be able to decrease the numbers in the long run. Because most of the time when we talk of policy, we talk of addressing people who are already sick, not really looking at how to prevent people from getting sick, or those who are already diagnosed, how to prevent progress of that disease. So while there has been a lot of dialogue at various levels, several consultations have taken place, very few platforms have given opportunities to patients to really come to the forefront and say how they can contribute. Also, there has been very little movement in the patient area, especially in diabetes and hypertension. There has been a lot of work done by cancer groups. It's a very strong movement in India, and they have very good representation. A lot of consultations have happened, and that's the reason why the registries have also started in that particular area. In other areas, there's not much that's happened. Whatever work has happened has been physician-driven, and now it needs to move beyond the physician-driven movements to really ownership by the patients themselves, so that a lot of work that happens in the prevention aspect of it comes to the forefront. But there's also been some good work, and I'd like to raise the august audience here that as a representative of DakshamA Health, which is a not-for-profit organization, we work very closely with PFCD and created an cross-disease platform of patient groups, not just the NCDs, but also other groups that are part of this. And we recently launched this cross-disease patient alliance in Mumbai. It is currently a 12-member organization, and it has representation not only from NCDs, but from Alzheimer's, from mental health, from genetic disorders like hemophilia and thalassemia, from rare disorders. And it's a growing group because there's more and more realization that unless the patients themselves drive the change, there is an important pillar in this whole change that needs to come that would be missing. In terms of challenges, because this is a very new concept in the NCD area, unlike groups like HIV, which have been very strongly funded, the groups are struggling to find their identity, to be able to connect with the right audience, to be able to understand what are the right platforms where they can participate, to be able to bring their voices, because as a new initiative, as a new concept, their focus is more on getting the medications. They're not really working at policy level or at behavior change. So every single patient group that I work with says, how can we get free medicines? How can we get free diagnostics? How can I get free treatment? And knowing that most of the treatment, especially for some of these disorders, is out of pocket, financing is a huge problem. And there is no insurance policy right now that really looks at outpatient care. It's more inpatient. So it's more when you are catastrophic that you get the treatment. There's no financing mechanism in the country that looks at forming an NCD alliance in India that's more India-centered, considering that we are a large country. So we hope that the patients will get more platforms and will be able to bring their voices to the forefront so that we are able to manage the epidemic in a better way.